A clash over hospital staffing. Today, Oregon's largest nurses union shared new plans to push for changes in hospital staffing laws after reporting record levels of nurse burnout and other staffing issues.
Some state lawmakers will propose the changes next legislative session. Fox 12's Adrian Thomas has the details of what's in the plan.
Wednesday, the Oregon Nurses Association said it's partnering with state lawmakers to introduce a new bill they say will address the staffing crisis in Oregon's hospitals. The proposed law would mandate certain staffing requirements in hospitals and make sure nurses take breaks during their shifts that they're entitled to. At a news conference at the Oregon Nurses Association, a former nurse shared her story about how staffing issues drove her to leave her hospital nursing job.
Even though I left the bedside a year ago, I still have nightmares of the faces of the people that we did not save. I carried the guilt of delays in care and miscare. I would go home wondering if my patients were going to be alive when I returned the next morning.
If passed, the proposed bill would also make penalties for hospitals that don't follow the rules more harsh.
The bill also gives healthcare workers and their unions the right to file a civil lawsuit over violations of the law and creates higher monetary penalties for the hospitals that are out of compliance with the staffing law, up to $10,000 per day.
But a group that represents the large hospital and healthcare groups in Oregon says a dramatic change in laws would actually cause greater damage.
Under the union's proposal, community hospitals may have no choice but to reduce services if they can't hire enough staff, which is likely given severe staffing shortages.
Those at the Oregon Association of Hospitals and Health Systems say they're aware of the staffing and retention issues, but feel there are other policy solutions to getting nurse staffing levels back to what they once were.
We're looking at tax credits for nurse educators, incentives for nurses, and then incentives for clinical placement so that we can recruit more nurse educators to train more nurses.
Any policy changes won't be introduced in the state legislature until early 2023, when the next session begins. Adrian Thomas, Fox 12 Oregon.